Okay, ladies and gentlemen, you're about to receive the world's first international medical podcast, hosted by 3 paramedics from different countries. Live from the UK, Finland and Australia, this is Group Call.
The reading from European Resus Council guidelines. Resuscitation teams should offer family members of cardiac arrest patients the opportunity to be present during the resuscitation attempts in case where this opportunity can be provided safely, and a member of a team can be allocated to provide support to the patient's family. Systems should provide clinicians with training on how best to provide information and support to family members during the resuscitation attempts. Okay. Resus Council guidelines. Should we treat it religiously like a gospel, or should we think a bit more critical about resuscitation and the family presence? Let's find out. This is Group Call Live. But before we start, I need to say something. We thought that this episode will have a slightly different topic. But straight after the previous episode, Aaron from Yorkshire contacted us and he said, guys, I have a better topic for you. What about family presence during resuscitation? And we thought, actually, that's a really good idea. And then he sent us a paper by him. But actually, let's say hello to Aaron. Good morning, sir. How are you?
Morning. Thanks so much for having me.
Pleasure. What's the weather down in Yorkshire?
At the minute, it's kind of too dark for me to tell, but it's been pretty chilly the past few days, and I'm not looking forward to having to emerge for my shift later on this morning.
Okay, what shift are you on today?
Oh, just on a little one today. I'm on an 11:20, so looking forward to that.
Stay safe today, mate. Tell us a few words about the work you've sent us, please.
So at the completion of my paramedic studies, I wrote a dissertation looking at whether or not witnessing resuscitation made it sort of more or less likely for family members and friends and loved ones of our patients to develop PTSD, and what the relationship between witnessing resuscitation and the sort of rate or effect of developing PTSD was likely to be, and then just considered how that should impact our practice. I guess that's kind of it in a nutshell.
Yeah, cool. And would you mind telling our viewers what's the conclusion from your work? So
there's not lots of especially pre-hospital research in this area, but there is some. But the research that exists suggests that we probably should be offering family members and loved ones the opportunity to witness resuscitation, and that it's likely to be either not of any harm or potentially of some emotional benefit to them in the long term, even if it may be more distressing in the short term. That seems to be what the strongest available research suggests, but that it's certainly not a definite conclusion. There are probably circumstances where it would be harmful, and those are things that perhaps you guys can flesh out a bit today.
Okay, thank you so much. Tell us about yourself. You are paramedic for how long, mate?
So I qualified as a paramedic last September. My training route involved a couple of years working as a sort of non-registered Band 5 clinician in the NHS, and I trained at the University of Bradford. I work at my local ambulance station in Doncaster in South Yorkshire, which is a little bit like saying I sort of work in a bomb site surrounded by enemies. It's fairly busy up in this part of Yorkshire.
And last thing, what is your practice? Do you actually implement the outcome of your research, or you change your practice after researching? How do you?
So I have to admit, I think that prior to having conducted this literature review, I leaned towards asking family members to leave the space when I was conducting resuscitation, and I think that was largely more driven by my own desire to lighten my cognitive load while I was working. But actually now, certainly in recent resuscitations I've been involved in, if I'm leading that resuscitation, I've been conscious of wanting to offer family members the opportunity to remain and to and to try and provide them with some commentary of what we're doing and why. There's some evidence to suggest that makes an impact on how well they deal with things over the long term as well. But it's the problem with resuscitation is it's very dynamic, isn't it? And it's down to the nature of who you've got with you as a team and the circumstances surrounding that event, and whether you've got the sort of resources to be able to do that effectively. Sometimes just physical space can be a premium, can't it?
That's true.
If you're not able to actually accommodate another person physically in the room, that can be a problem. But it was interesting. I attended a resuscitation just yesterday morning, and I was not the senior clinician at the event. I was the second paramedic, and it was interesting that the team leader asked the onlooker to leave the room. And at the time, obviously, we're busy providing care, so I wasn't going to sort of challenge that in that context. But it was just interesting that was his response. That was his natural kind of go-to in that situation. And maybe the evidence suggests that if in the long run, that might not have been the best thing to do, for that particular family member who was present during the event.
Fair play, Aaron. Thank you so much. The piece of work you've sent us is amazing. So thank you again. And we have a small gift for you. A giveaway.
Oh, that's very kind of you.
It is, look, group called Socks. So now you are part of the gang. I know that Harrison has one, and Timu and myself. So now you are part of our gang. Thank you so much.
I feel very privileged. Thank you.
Stay safe and stay with us. Cheers. And for you guys, you can call us now. We have a phone number which is 790-8000-974. So you can reach us on WhatsApp. You can call us from your mobile if you are in the UK. Just do not hesitate. Pop that number and comment and ask us questions live. Speaking of asking questions live, let me say good morning to Mr. Silva.
Good morning.
Finland, you said minus 20 degrees?
Minus 20 degrees, yeah, this morning.
And good afternoon to Mr. Steed, 30 degrees.
Yeah, mid 30s where I am at the moment, so we've got a good spectrum across the across the temperature gauge.
Indeed. Okay, cool, guys. Question to you: what are the main rules or main guidelines in your countries regarding resuscitation? Harrison.
In terms of family witness resuscitation, we don't really have any guideline around, at least in the service that I work for, and nothing that I could really find. It's something that's occasionally talked about, but not really discussed too much at length. It seems to be sort of up to the individual provider to make a decision. I know that there's been some cardiac arrests that I've worked on where there have been family present, and some where they've been, I guess, for lack of a better term, ushered out of the room. And it seems very dependent on the logistics of each individual scene. But it's fantastic that Aaron sent through this paper, because it's something that I've thought in the back of my mind is likely of benefit to the family in many respects. So it's good that we're discussing it today.
Cool. Timu?
So yeah, we don't have any guidelines on family witness resuscitation in Finland, at least not in my service. It's also not something that I've actually consciously been thinking about. So unlike Harrison, I haven't really paid any mind to it. But it is really important to actually think about it and approach it critically, because I do believe, especially after reading Aaron's work, that it can be of benefit following the resuscitation, for sure.
Yeah, so in terms of United Kingdom, again, we don't have any strict rules or guidance. We use European Research Council guidelines, where actually there's a suggestion that you should leave the family in the room if you have possibility to provide someone to comment what's going on, because on the other hand, it's quite complex procedure, so it would be good for someone to actually explain what's going on. However, COVID changed lots of things slightly, didn't it? And it's a bit more complicated now, but we still follow Research Council guidelines. In Poland, again, I hope that someone will call us from Poland. Please remember 0790 8000 974. Or just pop the comment in the comment section below. We tend to take the family members away, and now on the reflection, I don't really know, was it to protect the family, or as Aaron said, to protect own cognitive load with someone watching and being aware that we need to care for two patients actually, so patient in cardiac arrest and the family member. Cool. Let's see how they do it in America.
Hi, this is Gina LaRue-Wendy from United States of America in St. Louis, Missouri. Today we're talking about resuscitation attempts and events, and should the family be in or present during that event, or should they be out of the room during the event? When I had first started EMS a long time ago, I was an ER tech. And as an ER tech, we had many of codes. And during the many of code events, we would have like a consultation room in the very beginning. They would sit down, the family was brought in there. They would have a chaplain or a social worker, or call anybody that they would need to be with them, with that family member or family members during the code event, and somebody would come in and brief them shortly on what we were doing with their family member. And then probably I would say about 2005, we had a physician that had started in the ER, and he was really into bringing the family member into the code event. So we would be working the code, and the family would come in. It would be emotional. People would be crying over that patient. It would be purely sad, but I could see where one would have a comfort and a closure for it. Well, let's put that into the field. So whenever, depending upon what location and where you work, what region, what state, what city, it could depend upon if you would and if you would not. So example, I work in like a city/county region, and if I were working a code, I've had patients, family members, literally fighting over the jewelry that's still on the patient's hands while we're doing compressions on them. I'm not kidding. Then somebody would just go and grab a TV and run out the room, and you're like, was that a family member? They don't know. So it can be a safety issue. They start small and then they could get bigger, meaning like I say it's the oh my God squad now. I'm sorry if you don't believe in that. It's just a saying that I say because a lot of family members show up and they say, what do they say? Oh my God. And then they run to the patient while you're doing it. We do have law enforcement present. A lot of times they're very, very good about pulling the family members to the side, explaining to them what's going on, and then also too being there for our safety. Well, Now let's throw it very peacefully. I've had family members pray with me. I've had them sing gospel while we're doing CPR. It's a heavenly event. I've also had people that are very silent and understand that their family and loved ones have passed, and that we physically are doing and everything possible because they're seeing it and they're so grateful. And then I've had other people attack us, saying that we're not doing anything and we better do it faster. So it's very, very iffy in EMS. So you have to kind of keep your head in a swivel, again, depending upon where you work and your locations, and then your local protocols too. If the scene is always unsafe, always get out of there. Bring the patient with you, take them to the hospital. Now, pediatric events. Pediatric events, everybody's blood pressure's up, including our own. So we like to work them on the scene, but here in the state of Missouri, and St. Louis in particularly, we're not ready to call that pediatric patient on scene. So we're going to go ahead and kind of scoop and go. Now, any crime scenes of pediatrics or adult patients, we're not going to touch them unless told to do so by law enforcement, especially if they've been dead for a little bit. If there are still signs of life, then we're going to go ahead and treat that patient. Another thing is COVID. So COVID happened, and we had these patients that had passed away because that they could be COVID exposed and they could die from COVID. And then you could have a gunshot, but you could have COVID. So we were very confused about the particulars of what we should do. A lot of the officers were very good about it. They would be like, do you suspect any COVID? Do I need to report any exposures? And then they would get the appropriate place to put this patient afterwards. They're also very good about staying with the scene and the family members, and then having anybody there that needs to, like chaplains or additional family members. They're very awesome about that. So please follow your local protocols and stay on scene as long as you need to per your state, region, and medical protocols. And you guys, please have a good night. Bye. Stay safe and warm.
So yeah, I would like in the past, it's been more like a tradition to move the family away from the room. If somebody is like really hesitant to go away and they want to stay and watch, then we have usually accommodated that, but mostly we've been moving them out of the room. In terms of like the, I don't know actually. I think it's been like an older cultural thing where like medical treatments have been seen as private thingies. So then the patient is there, we are treating them, so then move the family away and then bring them in once we are ready to inform how it went. Or then it might be because of like the belief that the situation is so traumatic for the family that moving them away is actually going to help, or having them there might impede the work that we do, or might make us liable to like medical legal issues, like Aaron discussed in his paper, although he did say that that's not the case. So that goes to show that we have probably been dealing with this in the wrong way. In terms of the scene safety that Gina mentioned, I also wanted to comment on and ask you guys, do you actually get police on the scene during active research, because we don't. I would have probably firefighters there that I could utilize to gently and like gently try to move anybody who's disturbing us away from the scene. But obviously they can't really get that physical, and they shouldn't have to if somebody's being like aggressive about it. But in terms of like people stealing stuff and stuff like that, that's never happened in Finland, not that I know of. Yeah, it is, isn't it? Yeah, it is pretty crazy, isn't it?
Having never been to America, it kind of seems uniquely American to have that on a scene like that.
Yeah.
So, yeah. So I
does.
haven't experienced a scene like that, at least at a resuscitation. But yeah, Gina brings up a good point where, you know, Aaron, in the paper that he brought forward, it describes how, and as he mentioned on the call as well, a lot of these studies are done in hospital. It's a little bit more of a controlled environment than what we deal with in EMS, paramedicine, out of hospital, pre-hospital, whatever terminology you want to use. So yeah, we have the potential to sort of have those sorts of scenes. And even though I've never encountered someone trying to steal a TV while I'm doing chest compressions, that is a possibility. And she mentioned, I think it was the "Oh My God" squad. Was the tagline she used. Sometimes we do have, depending on the culture of the patient, a lot of family members, a lot of grieving family members, and sometimes it is quite intimidating to have all those people around you. As for the question as to whether we have police on scene to deal with that, we do request police here after the resus. So if it is if it's unsuccessful, if the patient has not survived, then police are required to work out the after death protocols and the like. But for the most part, unless they're specifically required for some other concern or something else as part of their duties, we don't have police on scene at a normal resuscitation. So for the most part, the direction of the family is on the paramedics here in Australia. And yeah, for the most part, it really comes down to logistical issues. In the paper, it sort of described that a lot of the recommendations where family witness resuscitation is recommended, it's also it's best when there is sufficient resources to be able to have someone comforting the family and describing what's happening, acting like a liaison essentially in that role with the family. And in hospital, there's more people around. There's generally more possibility to have that role in place. Whereas out of hospital, we don't always have that, so it can make that a little bit difficult. So I can understand the hesitancy of a lot of pre-hospital providers in implementing that. If you've only got two people, one on the airway, one on chest compressions, you can't really have a person comforting the family. And even if you have another crew, you've got 4 people on the scene, you're often, for the most part, all involved in the resuscitation at various stages and various tasks. So it's difficult to have an extra person liaise with the family. But that makes it no less important. So in normal circumstances, we try to have a person liaising with the family where possible. And as I said, for the most part, they'll be out of the room. But I think that where possible and where suitable, my personal opinion is that it's been beneficial to have them in the room. It's only happened a couple of times, I must say, but and it's very dependent on the circumstances as well of the resuscitation. If it is quite confronting, if it's a traumatic scene, physically traumatic, then that might not be the best time to have the family in the room. And likewise, when there's intubation and other invasive procedures occurring, it's, in my personal opinion, it's probably not best that the family witness that. But after those things are done, I think it is good to have the family present. As mentioned in the paper, they can see what we're doing. They can understand that we're doing our best, and someone's there describing that and helping them understand. One part that's perhaps a bit controversial as well is not only having the family present in the resuscitation, but having them actually involved in it firsthand. And this is something that has happened to one that I've been to previously, where on our arrival, the patient's son was giving chest compressions, and they had been doing so for quite a while, so they were quite fatigued. But later on in the resuscitation, we were all in the one big room, so that they were present regardless. And we had a person designated to liaise with them. And the son asked, "Can I do anything? Can I help?" And not everyone's going to be like this, but this person was asking for the opportunity to be involved, because standing back, I can understand that feeling of helplessness from the family member. So it didn't impede on our resuscitation efforts. At that stage, our belief was it was trending downwards and it was not going to be successful, and therefore what do we have to lose to have this family member involved in it? If that's going to be comforting for them, that they're feeling like they're involved and they're trying to help their family member, then why not? It's not something I would offer every single family member. Do you want to do chest compressions on your family member? But if they ask, and if we believe it's going to be beneficial to them, then I don't see a reason to stop them.
Also, like, first of all, I think your mic was muted for most of that, unfortunately. So
Oh
I
gosh.
don't know
Okay.
if anybody.
Yeah. No. Okay.
But yeah,
Mhm.
Alex was telling us about PJ from Australia, who sent us like a comment saying that the only time he's questioned having the family on scene was when a 6-year-old child was watching Resus on her grandfather, and Alex was asking us about how we would deal with children. Like the first thought that comes to mind is, like, first of all, I would probably, even for adults, I would offer the option. I would probably not encourage them unless sufficient evidence is provided that it's actually beneficial or neutral to them. I feel like pushing them too hard might lead to issues. Whereas if I just encourage them to, well, offer the option, then they will make up their own mind, and they will have that possibility to affect it more, I think. So in terms of children, I think I would leave it up to the parents. A 6-year-old for me is a bit too young. 10 maybe.
So where is the line?
Like, it's really hard to tell with kids, I think, because like they are all different. You might have like a really developed 6-year-old that can deal with death and has been like it has been discussed with them. Maybe they have had like a pet that's died or a family member. They might have been to a funeral, so it might not be the first time they're dealing with death. Because I think resuscitation and watching it is probably not the first encounter with death that you want your child to have. But yeah, leave it up to the parents. That's my take on it, I think.
Yeah, I agree with that. And I think when you say, you don't want it to be their first encounter with death, I think is a very excellent point. I mean, if they've encountered family members or whatever that have died and have gone through that grieving process and understood the concept of death, then perhaps those children might be emotionally developed enough to deal with the concept of a resuscitation and understanding this is what happens when we are trying to save someone's life. But yeah, I think you're right. If they haven't had that exposure previously to any form of death, it may be confronting. I mean, it's confronting enough for a child to, say, be at a funeral. It's confronting enough for them to go and see a grandparent deceased in a bed, and if they're doing a viewing or what have you, it's confronting enough for those sorts of encounters. So I can only imagine that a resuscitation would be all the more confronting for the child. So I think I agree with Timu on the point where it would be up to the parents, because they're going to know the child a lot better than we are. And what Timu mentioned before as well, where you, even disregarding the children at the moment, but you're offering the ability to the adults on scene to come and witness the resuscitation. You're not forcing them. You're giving them the option. They can make the decision if they want to do it or not, and they will know whether they're ready or not. I think saying the door's open, come inside and look at what we're doing so that you can understand, I don't think that would be very helpful, because everyone's different. So, and people, we're going to offer it to people, and some people are going to decline and some people are going to accept. I think that in Aaron's paper, the figure was, I think, 87% of people who were offered to witness the resuscitation did decide to witness. So there's still a cohort of people that didn't want to witness. But yeah, back to the kids. I think it should be left up to the adults, and discussing it as well with the adults that, look, if you like your child to witness this, they can. However, if this is their first experience and encounter with death, it may not be the best. But again, leaving that up to the parents, I think, is important.
If the parents are at scene. So again, because my mic was apparently muted, I'm sorry, it's so embarrassing. I will just quickly refer to the story I told. So we went to the farmer who hung themselves, and there was a child, I think 6 or 8, years old who was watching resuscitation of his father, just cuddling a small dog, a puppy. And I think that's the worst job I ever done. Not because of the injuries or condition the patient was in. It was about this small boy watching the resuscitation. I remember shouting to the police officer, get him out of here. And then police actually just drag him out of the scene. And I still don't know, did I do good or did I do wrong? Because I thought it's inappropriate for him to watch it. And again, this Polish, let's take them out of the way thing. Cool.
Hi, I'm Nikki. I'm a paramedic, and you're watching Group Call Live.
If you were offered the option,
Yep.
I think that I would want to be involved if it were my family member. I think the reason being, we're in this job. We understand the processes that are involved, and we've encountered that dozens and perhaps hundreds of times, depending on how long you've been in your career. So it's not foreign. It's not foreign to us. And I feel like, touch wood, if that were to happen to my family member, that I would want to witness, to sort of share that last moment with them. But that being said, not everyone that we go to is a paramedic or a nurse or a doctor.
Yeah.
So, How about you, Alex?
I think I would like to be present, but the problem with me is that you know me. I would love to be involved, and I would actually be involved into medical procedures, and I don't know how the crew would react to have a family member actually intubating or trying to put the needle in. But I think I definitely would like to be present because I would have this opportunity to witness everything and be there, not only for my closest person, but also for myself, knowing that everything that could be done had been done. What about pediatric and resuscitation? What about resuscitation of the baby or child? Should parents be present or not really?
I think definitely yes. It's like it's going back to like what like my take on having to watch a relative being resuscitated is like I don't really want to be there, but I don't want to be elsewhere either. I don't want to be in the other room waiting. It's because it's going to be going on for like 30 minutes or so unless there's conditions that like shorten the time that we attempted. That 30 minutes probably would feel like a lifetime. It would be just unbearable waiting in the other room. I would rather be there than be away. And I think it's the same for the parents. Like normally I would want to do the procedures first and then bring the family in afterwards, like intubation, IO, IV, like get the ball rolling, so to speak. But in pediatrics, the parents are going to be there when we arrive, most likely. And I can't see any way of like removing them from that scene, from the side of their child. It's just not possible in my opinion.
No, it'd be much harder to break that bond. There's that strong emotional bond that a parent's going to have with their child. So to physically break that bond and move them out of the room is going to be so much more difficult. I mean, a neonatal arrest that I had, I mean, at the time, they were still attached to the mother physically. So, and obviously they were detached and then and the resuscitation was commenced. But it's very hard to sort of separate them and say, all right, now you have to leave. It did make the resuscitation more difficult in hindsight, more difficult than it already is with an infant, because the family were present and there was several other people present at the time. But I think Tim is right. Like you can't really have it any other way. It was, it ended up being a futile resuscitation. But to have the family ushered out of the room, the parents and everyone else that was at scene, I don't think would have been very helpful to their grieving process, because they had the opportunity to see what we were doing and understand what was happening. And luckily at that time we did have plenty of resources. We did have someone liaising with them throughout the whole thing. So
That's quite interesting what you said about detaching a newborn from mom, so cutting the umbilical cord and removing them to the different place. And as you know, it is my thing, obs and gynae and newborn resus. And what we want to do now in the UK is try to change the approach to take the baby away for resus. So that's a very hospital-focused approach because, as you know, at hospitals they have a small beds with heaters and like a resus stations ready for the baby. And even for a thermal control, it's really good to take them away. Now, in pre-hospital setting, what we are trying to achieve now is to bring the resus to the baby, not baby to the resus. And what we do in pre-hospital setting is we tend to ask parents for like a changing mat and then put like a towel on the changing mat because it's quite slippery. So to prevent this, we put the towel on it and then BVM, OPA, IGEL, whatever you need, we just lay out on this changing mat. And this changing mat should be next to the lady in labor. And then if there is a need for resuscitation, you have everything there, and you actually physically bring the resus to the baby, not baby to resus, for few reasons. One is delayed umbilical cord clamping and cutting. The second thing is the psychological side of the thing, to keep them together, because if resuscitation will be unsuccessful, then it will help with grief. But that's just what we're trying to do now. Is not a guidance anywhere. It's just changing the approach. Cool. So let me sum up, guys. Family in the room unless there's no one to assist them. Is that the vibe I've got from you guys?
Yeah, definitely. Just unattended in the room. I
Not
think
really.
it's asking for trouble. Yeah.
Yeah, giving the family the option of sharing their family member's last moment, but not being forceful with it, I think is probably the best outlook.
In terms of pediatric, in terms of children watching the resuscitation, it's up to the parents, right? I think that we all agreed here, and definitely pediatric resuscitation. We are not trying to not even trying to remove parents from the room. Is that,
yeah, and also like one more thing that I forgot to mention is like, because like I know in the UK the paramedic calls it, but in Finland I have to call the doctor, like do like a consultation and then call it. Well, they call it over the phone and then I call it on scene, but that's the doctor's decision. What I like to do is I like to talk to the patient before I make the call. It's like tell them where we are at, what's the situation, what I'm going to be doing next, and this is the most likely outcome of this. Like if it's like 99% sure that it's going to be called, then I will talk to them before. If I'm unsure, then I will just call first and then explain it afterwards. But yeah.
Yeah, I don't think I've been present at a resuscitation where we've called it prior to letting the family know at scene. So sometimes we've walked in and we haven't commenced for some other obvious reasons. But for ones that we have commenced and we've attempted, each time we've understood, the providers that, this will be our last cycle. And then someone will go advise the family and then make sure they're okay with it, for lack of a better term. They'll return into the room and then it will be the resuscitation will be ceased.
Let me stop you here for a second, mate. You just reminded me a story that, okay, it's funny and not funny. So here I am in the room. I think I was on my third mornings there in the UK. And there's a crew performing resus on the patient and the families in the second room. We have amazing chap there with the family who's talking them through the whole process and trying to comfort them and so on. And I'm in the room with the patient in resus, and then person who was running the resus says, Alex, would you mind letting them know that that's our last cycle and the resuscitation will be stopped? So I went to the second room saying, what's going to happen. I came back to the first room, and guess what? They've got Rosk.
Yeah.
So, yeah, how embarrassing. But hold on, that's just the beginning of the story. So I went back to the family room saying, guys, I'm very sorry. He just came back. So they were really happy. I came back to the first room, and guess what? He rearrested, and he was in PA. It happens 3 times, okay? 3 times I was going to the family room and back, and then I thought, no, hold on, maybe let's wait to actually we will have the final outcome rather than me saying yes, no. It was embarrassing and sad, but very, very surreal, as you can imagine. So
talk about
wait,
a roller coaster of emotions.
wait before you will make this call, and wait before you will actually tell family in the other room that that the person died or did not die. Happy?
Yeah, that's true.
Thank you so much, guys. I mean, our listeners and viewers, thank you so much for joining us today. We had Lindsay, Claire, Nick, Gina up there in the United States. Aaron, thank you so much for sending us this paper. I hope you like the socks. They are really warm. I think that Timu in Finland tested them in the extreme environment.
Yes, definitely.
And can say that they are really, really warm. Thank you so much for watching. That was Group Call Live. Hopefully, guys, we will see you in 2 weeks. Stay safe. And don't forget to subscribe to the channel and click the bell button not to miss any content from us. Goodbye and have a good day or good night.